What is passive euthanasia? Have you ever wondered what happens when a patient chooses not to receive life-sustaining treatment? This is where passive euthanasia comes into play. Passive euthanasia is the practice of allowing a patient to die by withholding or withdrawing medical treatments that keep them alive. Instead of actively causing death, it involves letting nature take its course. This means that if a patient is on a ventilator or receiving nutrition through a feeding tube, doctors may decide to stop these treatments. By doing so, they allow the natural progression of a terminal illness to lead to death. The key here is that no direct action is taken to end the patient's life. The ethical foundation of passive euthanasia revolves around the intention behind the decision. Some people argue that choosing not to intervene can mean wanting death to occur, while others believe that simply recognizing death as a possible outcome is enough. This debate about intention is significant because it influences how we view moral responsibility in these situations. In many cases, discussions about passive euthanasia focus on the patient's values and wishes. Modern bioethics stresses the importance of respecting patient autonomy. If a competent patient decides to refuse life-sustaining treatment, it is generally considered ethically appropriate to honor that choice. Forcing treatment against a patient's wishes can be viewed as paternalistic and unethical. When we talk about passive euthanasia, it is essential to understand that these decisions are not merely acts of omission. They are deeply tied to respecting individual moral values and dignity. The distinction between passive and active euthanasia has sparked considerable debate. Some argue that the difference between allowing death and causing death is not morally significant, while others see it as a critical ethical line. This discussion connects to broader themes of moral relativism and pluralism. Different ethical frameworks can lead to varying conclusions about whether passive euthanasia is permissible. In practical terms, passive euthanasia often arises in end-of-life care. Here, decisions are made to stop or avoid treatments that prolong the dying process without improving the patient's quality of life. In many places, passive euthanasia is legally accepted under strict conditions. This reflects a societal acknowledgement of the moral complexities involved. Overall, passive euthanasia is about withholding or withdrawing life-sustaining treatment to allow a patient to die naturally. The ethical justification mainly hinges on respecting patient autonomy and the intentions behind these decisions. It remains a vital topic in discussions about morality, medical ethics, and end-of-life care.